Hi there. Thanks for joining me for the first in several videos I put together on COVID-19. I decided to split this up into 3 separate videos because, as you know, there's so much information out there about this virus. And I wanted to keep the videos as compact as possible so that you don't have to listen to an hour and a half of information at a time. It's a lot to take in. So I've broken this up into 3 different talks, and a lot of this is based on all of the wonderful questions you guys have been calling with to the office, as well as completing the survey of questions that we sent out a few weeks ago with both comments on what you want to know about and then specific questions. So I'll try to touch on all of that as much as possible in the next few videos. Today I just want to talk a little bit about some of the epidemiology of the virus, the transmission, how it's transmitted, and then symptoms and what to do if you have either symptoms of COVID, if you've had an exposure, or if you have known COVID. I am going to be looking at notes during this, so forgive me for looking away, but I have a lot to get through and I want to make sure that I'm accurate. Can't remember it all. Okay, so some information about the epidemiology of this virus. We know that it originated in Wuhan, China, and the estimates are that first case began around December of 2019. The first case here in the United States was traced to Santa Clara, California in mid-January, believed from an individual who returned from travel to Wuhan. Around that time, we saw a big outbreak in Washington State in the nursing homes, and then into the general community. And then the explosion occurred in New York City in March, but it is likely that the virus was present there as early as mid-January, and the cases were just unrecognized. The explosion and the complications of this virus were complicated by the lack of personal protective equipment and ventilators, and also testing, which was extremely limited. We're moving in the right direction in that regard, still having issues, but that is really what is felt to have allowed this virus to sort of spiral out of control in its early onset. There were some issues with testing with the CDC, some errors there. Unfortunately, that put us back about 2 weeks, and as a result, we think we really got behind the 8 ball on that. In any event, we're hoping that we've learned a lot from that and how to move forward in the unfortunate but likely circumstance that this virus may resurge. The burden of disease, I really like to stress this because it actually has implications for how long we may be in this situation. And right now, it's really kind of across the board that in the world, in the U.S., in Pennsylvania, and in Bucks County, assuming we trust the current results. I mean, we know that the results are changing because we are doing more testing, but right now, as of today, the percent population across the board from world to our county is less than 1%, or less than 0.1%. Okay, so 0.1% of the world population is affected by this virus. So that sounds like such a small amount, and we know it's really not because we look at the magnitude of this virus. But the importance of that point is that in order for us to develop what is called herd immunity, and that's when we can all sort of be protected by those who've been infected around us, we need about 60 to 70% of the population infected, okay? So we are not even close to being where we need to be for herd immunity. Of course, we're hoping that we have other ways of treating this virus or preventing this virus in the interim, but we don't have that yet. So what that means is we have to assume right now we're in this for the long haul, and we have to be really careful. In terms of other epidemiologic factors, people have asked about whether temperature may have an effect or humidity may have an effect. There is thought that the virus may not be able to withstand very high temperatures. UV light in certain spectrums, unfortunately, is the spectrum C, which is something that's actually damaging to our tissues and can cause cancer, may be able to slow down the virus, but we're really not sure yet. So what we can't assume is that weather-related changes in warmth will make the virus go away. It is anticipated that as of right now, the recent White House modeling has suggested that we're going to see a slowdown June, July, and sort of level off in August, but there is now emerging concern for a resurgence in the fall. And whether that's temperature related or more related to opening up the country slowly, that's hard to say. But based on how other pandemics like the flu pandemic in 1918, how that surged, there was a huge surge and a slowdown and then a resurge. So this is behaving somewhat like the flu. So we do need to be concerned that we're going to have a resurgence. I wanted to touch back on the burden of disease. Right now, if you look at the world population and the numbers that we have tell us how many deaths have there been among confirmed cases, and the percentage right now is about 5.6% in the world. Now we really do, I think we know that that's not an accurate estimate because we're doing more testing, and so the recent modeling I've seen is that the fatality rate of this virus is about 0.4%. So it is far less than the numbers would tell us right now. That's, again, according to modeling. That's still about 4 times as likely as the flu mortality, which is 0.1%. So there is a significant increase in the mortality, but possibly not to the degree that we expected when the pandemic first exploded. So who seems to be affected by this virus? Unfortunately, as you know, it does not seem to discriminate. Certain people may be at less risk. Children, we're seeing, have a lower risk of either getting infected or getting very sick from infections, but there are children who do get very sick. The highest risk individuals are those with chronic medical conditions, so asthma, COPD, heart disease. And by heart disease, we're really talking about significant risk with coronary artery disease or heart failure, active disease. Diabetics seem to be particularly affected, and again, the less controlled your diabetes is, the more at risk you're going to be. And obesity, someone asked about obesity, and it turns out obesity is one of the biggest risk factors for complications of this virus. We talk in this practice all the time about how our weight can impact our health in so many ways, and this is just another way that being a non-ideal body weight can affect you. It's felt that those with obesity have some intrinsic weakness of the respiratory muscles and also some airway resistance issues where their airways are more resistant to airflow, and that puts them at higher risk for the respiratory complications, which is generally what causes people to succumb to this disease, is the lower respiratory complications and the inflammatory response that's generated. Along those lines, fat cells, we've discussed that fat cells are inflammatory, right? They cause inflammation. And in a disease like COVID, where there's known to be an exaggerated part of really how this disease causes the biggest problems is it's promotes a very exaggerated inflammatory response to the virus, and that's what really makes people sick. So if you combine that with the inflammatory nature of fat cells, you're sort of getting a double whammy there. So obesity is a big risk factor. And statistic-wise, those with a BMI, body mass index, between 30 and 34, twice as likely to be admitted to the hospital. And if your BMI is over 34, you may have 3 times the risk of landing up in the ICU. Someone asked about high blood pressure and whether that qualifies you as a person with chronic medical condition. My initial answer to that question, I'd spoken with someone over the phone or maybe through communication, that it wasn't considered a significant risk factor. However, there was a recent study done in hospitalized patients, and those with hypertension, particularly those with uncontrolled hypertension, were at higher risk of mortality. Those who had controlled blood pressure did better. Those who are on medications did better. So again, you look at medical conditions are going to increase your risk. The better controlled you are, the less risk you're going to be. But you may be at higher risk than someone who has no chronic medical issues. We also know that those over the age of 65 are particularly high risk. It's estimated that 60% of adults that are age 65 to 84 will end up in the hospital if they have COVID. Now, this is evolving in terms of the data. Why is that? The elderly may be more likely to have chronic medical conditions, which puts them at risk. That's a population that really needs to take extra caution. And I'll explain when I go into one of the following videos. Talks a lot more about prevention and sort of what that means. Again, children are less likely affected. There has been a sort of later onset inflammatory condition called Kawasaki's disease that we see in children again, but that is rare. Of course, socioeconomic disparities exist that make some more likely to get sick. Those in the minority communities are particularly affected, and that has varied reasons. They maybe tend to, in general, will live in more crowded environments. There may be multi-generational families, which sort of increase the risk of exposure. There may be less access to healthier foods, less access to fresh air. A number of things really exist in minority communities who are particularly affected. And it still remains a mystery why some seemingly perfectly healthy individuals succumb to this disease. It's really the science behind this is still fresh, and trying to learn about who might be at higher risk or whether it really is discriminating in all cases. Again, the important point that I touched on early was that this is not really likely to go anywhere anytime soon, and what we may see again is a resurgence of this in the fall. So I think continued measures are really important. And again, we'll talk about that when we get into the prevention section. Transmission of this virus. Okay, this is again also involving when the virus was first discovered. It was very clear that respiratory droplets are a huge source of infection. And respiratory droplets, when we cough or sneeze, certainly we know, like if you don't cover your face, you're spewing, secretions into the air. If those droplets land on someone else or land on a surface, and that person who the droplets land on touches their face, or they touch a surface, which we'll come to in a second, that has the virus, then they may become infected. We're learning that things as simple as speech and singing, the choir incident out west, where there were a large number of choir members affected by one positive case, and actually a significant number of deaths happened in a room where people were singing, and presumably distancing themselves during that. What is a little scary is that we are learning more, and it's been suspected for a while, and it's still not really out there, but that aerosol or airborne transmission is very, very, very likely. There was a study published within the last few days in the Proceedings of the National Academy of Science that actually studied 3 epicenters of the virus in Italy, Wuhan, and New York City, and looked between March and May. And were able to assess that masking in this period of time is what has actually contributed most to decreasing the spread of disease. And if you think about what masking does, masking really is helping with the airborne component of this, because if social distancing were enough, you wouldn't really need to wear a mask. Aerosol is scary because it just means that social distancing may not be enough. And again, we'll come back to that when I talk more about prevention. Of course, those with closer contact with infected individuals, those in crowded environments, and longer times of exposure, or exposure to high levels of virus, like in healthcare workers, are going to be more likely to get sick. Okay. Surface transmissions. So the CDC recently made a statement that suggests that surface contact or contact with surfaces that have the virus are less likely to transmit infection. And the last statistic that I read was that about 6% of cases can be explained by that. I think CDC is purporting that it's less. That said, we still believe that it is important to avoid touching high-touch surfaces. Certainly if you're out and about, you want to be washing your hands, and then, knowing too, there are certain surfaces that are more likely to carry virus for a longer period of time. Things like cardboard are really a minimal time that the surface can survive. The virus can survive on that surface. Metal, glass, ceramic, paper can actually hold the virus for several days. And I'll talk a little bit more about what you do with that, especially with mail and groceries and those sorts of things, in a later session. There's no evidence of this really being foodborne, so if you're ordering food, eating food, there's really no evidence that you can get this from food. Water is not a source. Bloodborne transmission has not been demonstrated. Fecal oral transmission, which is, obviously, feces to oral, which is a common vector for a lot of infections, has not been demonstrated, though there have been studies done in bathrooms that have shown the virus really is very highly prevalent in toilet seats. So there is some concern that there could be some stool sources of the virus. Whether that's truly infectious, we're not really sure. So again, it just means we need to be careful, which we should be doing anyway. One of the most important concepts of transmission, and this is why protecting yourself and others is so very important, is that recent study just demonstrated that 40 to 45% of people who have COVID infections are asymptomatic, and that a minimum of the spread of this virus, a minimum of 30% of the spread of virus, is attributable to asymptomatic cases. So people are unfortunately in the community who have no symptoms who are spreading this disease, and that is why it is important for you to really assume that someone, unless you're really sure that they've been socially isolating, anybody that's out in public could potentially be a vector for this disease. The other transmission component of this that's very important is that people are most infectious from this disease one day prior to their symptom onset. So again, the people who are most likely to infect you are actually asymptomatic. It's expected, or it's in the absence of mitigation, in the absence of protective measures like social distancing and masking, this virus has the capacity to infect anywhere between 2 and 3 people per one person. When you add in all of these mitigation efforts, we can reduce that, and the goal is to reduce that to less than 1, right? Because that means less than 1 person is infected for every person. They've been able to achieve that in the UK with lockdown measures. There are cases of super spreading where one person is able to transmit this disease to multiple people, and usually that's from someone who's particularly ill. When there's a very crowded environment, we do see that also in congregate settings like nursing homes and prisons. You're going to see more of that because of the crowding of the conditions. It is felt that infection, if you're around someone, in contact with someone, that infection will be less likely if you are exposed to them for 15 minutes or less. Okay, so that's information about transmission. Let's talk a little bit about symptoms. So what are the symptoms of COVID? We know that the virus is transmitted initially to the nasal passages and what we call the nasopharyngeal passages, so the nose and the throat. And then over a period of time, the virus begins to exert its effects in the lower respiratory tract. Okay, typically symptoms, and 50% of people who actually become infected, people who get symptoms, will do so within 5 to 6 days of exposure to the virus. Okay, so the average incubation period where you go from getting infected to symptomatic is about 5 to 6 days, but we do see in some cases up to 14 days. And symptoms will typically last 5 to 10 days. So the typical symptoms include fever, but not everyone has a fever who has COVID. So it's really important that while fevers are helpful, the absence of fevers does not exclude COVID. Cough is obviously common. There has been the interesting symptom of loss of smell and taste, which is felt to be related to olfactory nerve inflammation or infection, or somehow it affects the nerve. Some people have that as their only manifestation. We do hear cases of that. Chills, muscle pain, headaches, sore throat. You can get conjunctivitis, pink eye symptoms. Some people get GI symptoms, gastrointestinal symptoms like diarrhea. Mental status changes, confusion, agitation can occur later in infection. And then there are some sort of what we call thrombotic or blood clot manifestations of COVID, including COVID toes, which are some bluish discoloration that has been demonstrated in the toes, and then some systemic inflammatory syndrome that's seen in children called Kawasaki's disease. I mentioned that as well. 20% of people who are infected will go on to develop more symptoms in the lungs, and this tends to be where people run into trouble. As people ask, how long, if you have COVID, how do you know if you're okay? How do you know when you're cured? How do you know when you're no longer infectious? So it's estimated that the virus should be cleared and you should be non-infectious from 8 days after the onset of your symptoms. Okay, it seems to be cleared by that time. There are some who push that a little bit more towards the 14 days, but everything I'm reading and hearing is that by 8 days you should no longer be infectious. And again, it's from the onset of symptoms, not necessarily from a positive test. Okay, it's onset of symptoms. Testing can actually remain positive for weeks, and what that means is it's not diagnostic of infection. The assay that's used to detect infection is an RNA test, so it actually measures the RNA from a virus, and you can have shedding of viral particles, of dead viral particles that will still have obviously the DNA component of that, and still be present for weeks. So retesting for cure is not something, at least by the assays that are currently available, you really have to put culture things to do that, is not terribly helpful. Okay, what do you do if you're sick? This is a big component here. So if you don't feel well, if you have any symptoms that are concerning, you're a patient of Center for Comprehensive Health, the best thing for you to do is to call us so we can sort of guide you. I have a very low threshold, as I think we all are moving towards with the availability of testing. We should really be testing. That's important for you so that you know what your course might be. Obviously, if there's treatment options available, we don't have those yet. And then, of course, allowing for contact tracing so that we can halt this the spread of this in its tracks. So the more testing we do and the quicker we can get results, the slower we can slow the progression more. If you have a positive COVID test, okay, what that means is that you are infectious and you need to self-quarantine, okay, and you need to do that for a minimum of 10 days after you begin to have symptoms, okay. And in the last 72 hours of those 10 days, you have to be fever-free and really with improvement of all of your respiratory symptoms. Okay, so you're locked down for a minimum of 10 days, and then if you're still sick at day 14 and still having fevers, you're still locked down. So you need to have 72 hours of a period of fever-free and symptoms improving. Now, if you have a positive test, but you were asymptomatic, and there are certain reasons why we might test asymptomatic individuals, which I'll talk about in the testing section, you have to quarantine 10 days after your positive test. Okay? If you have COVID, you need to follow certain measures, right? So you're quarantining. What does that mean? So you don't go home, you don't go out. You should not be leaving your home. If you need groceries, somebody should be picking them up or delivering them to you. You really need to stay in your home away from everyone. You should, when you're in your home, if there are others who live with you, you want to maintain at least 6 feet of distance, and ideally you should have a sick room. If you're not isolated in your own room, if you're walking about your house and there are other individuals in the home, you should be wearing a mask. Of course, covering your coughs and sneezes, washing your hands frequently, no sharing of personal household items, towels, dishware, utensils. Those should all be sort of kept to your own area. Cleaning high-touch surfaces frequently, countertops, doorknobs, anything that's touched frequently in the home should be cleaned with disinfectant. Of course, you want to monitor your symptoms. You want to monitor how you're doing of course, if you're experiencing any worrisome symptoms like trouble breathing or chest pain, mental status changes, those obviously need to be watched for by other members of your family. Blue lips, facial blueness, all of those things suggest you're running into respiratory problems, and that means you need to seek medical attention. That's called ER. Always call me, but that's usually going to land you in the ER. So that's what you want to do if you're positive COVID. If you're sick, if you're sick and you think you might have symptoms, I have a low threshold for testing. If you're sick and you've had a positive exposure and you're not tested, then you should just assume that you are infectious. So what do you do if you've been in close contact with a COVID positive individual? Okay, so close contact, we want to define that. What that means is it's really any person, any individual who's been within 6 feet of an infected person. And I'm not going to go so much by the 6-foot rule because of the fact that there could be aerosol, but I would say significant contact within someone for at least 15 minutes, and that's starting from 2 days before illness onset, okay? If it's an asymptomatic patient, then it would be 2 days prior to the positive specimen collection. And again, that's because people are particularly infectious and spreading the virus before they actually have symptoms. And if you are exposed to a COVID positive person, you meet sort of that criteria for someone's at high risk of having sustained the infection, then it is important for you to quarantine for a total of 14 days. And the reason for the 14 days is that the incubation period can be as long as 14 days. So you could develop symptoms anywhere in those 14 days and become infectious. If you are exposed, you want to stay home, quarantine, monitor for symptoms, and that involves checking your temperature twice daily and looking for any of those symptoms that are sort of cropping up. If you are sick, if you start to develop symptoms, you obviously then have to isolate in the home, and then in general there's a consideration for testing if you get sickness, and then more and more we're looking at testing contacts again, but that runs into some limitations which we'll cover. Contact tracing is very important. So if you are tested positive for COVID, it's important that you let anybody that you've been around that you think could have been exposed significantly, let them know. And then those people would obviously need to quarantine, possibly be tested. And then if they've had any significant exposures or if they're sick with any symptoms, then they need to obviously let their contacts know. So we're hoping to sort of quash this if we can identify disease as soon as possible and then reach out to contacts. That's hopefully how we're going to be able to keep this under control. So that actually concludes this first portion of the video series. I'm going to be next talking about prevention. That will be its own dedicated talk, and then subsequently I will do a video on testing, and also then talk a little bit about treatment, which is will be quick because it's right now a lot of this is in its infancy, and that's sort of more for informational purposes. Thanks for your attention, and we'll talk again soon.